Good God, baby, what are you doing to me?
Oh, hello. I didn't see you there. I'm Scott Fox, lifelong insurance nerd. Thanks for tuning in to my live stream. The annual enrollment period is officially here, and it's time to review your Medicare coverage for 2026. There are some major updates this year, and they could directly impact your coverage, your premiums, and your plan options. In this session, we're going to focus on what's confirmed and talk a little bit about what is proposed. Most of all, what it all means to you. The goal is to help you stay informed and prepared before the December 7th deadline. Whether you're already on Medicare or turning 65 soon, this session will give you clear, real-world answers about what's new for 2026. So go ahead and drop your questions in the chat. I answer every question, even if it comes in after this stream is over. I'll answer questions that are in the chat. All right, let's get nerdy. Question 1. What changes are coming to C-SNPs and D-SNPs in 2026? Well, this is what we know. The calendar year 2026 Medicare Advantage and Part D rule includes some major updates for both dual eligible and chronic condition special needs plans. That's D-SNPs and C-SNPs. Benefit options for supplemental coverages like dental, vision, and hearing stay stable, and CMS has confirmed that access to Medicare Advantage coverage remains strong. Over 99% of beneficiaries nationwide will still have at least one Medicare Advantage option. Now, these C-SNPs and D-SNP plans, they are designed for people with certain chronic conditions or those who qualify for both Medicare and Medicaid, or Medi-Cal in the state of California. The 2026 updates aim to make these programs more coordinated. Now, as far as projections for 2026, we expect to see strong growth in SNP availability. Chronic and dual eligible plans are projected to expand roughly 10 to 15% next year. The reason for this is carriers are shifting resources towards these specialized populations. That means that if you have complex medical needs or you're eligible to Medicaid in addition to being eligible for Medicare, you may see some new plan options with richer benefits. Things like specialized medications being in the lowest tier. So in other words, expensive medications for cheap. Other things like transportation, home-based care, meal delivery, and you'll usually see some sort of care coordination team that sort of quarterbacks all of the different specialists needed for a specific chronic condition. Now, with some carriers pulling back from the general Medicare Advantage markets, the C-SNPs and the D-SNPs could kind of fill this gap for people who qualify. So if you're just joining us, please tap the subscribe button so you don't miss next week's Medicare update. Let's check the chat, see if there's anybody. All right, got a few people on today. Don't be shy. If you have any questions, feel free to ask them of me. Meanwhile, question 2. Will the Medicare Advantage out-of-pocket maximum change in 2026? Well, here is what we know. This is, well, yes, it's one of the few numbers that's actually going down. You don't usually see insurance companies lowering rates, but in this case you do. The Medicare Advantage out-of-pocket maximum, and that is the cap for your in-network Part A and B costs. This is dropping slightly from $9,350 in 2026 to $9,250. I'm sorry. In 2025, it was $9,350. In 2026, it's going to be $9,250. So that means that once you've paid that amount in cost sharing being your deductibles, co-payments, things of this nature, your plan pays 100% for the rest of the year. Now, most plans already have limits below that cap, but this official CMS reduction gives beneficiaries a bit more protection. So, projected for 2026 and beyond, many insurers are expected to maintain their lower maximum out-of-pocket caps for the year, but may shift how cost sharing is distributed. So put it in English, even though your overall cap is going to stay the same or drop, you could see higher co-pays on some services, like specialist visits or outpatient procedures. You could go to more co-insurance and fewer straight co-pays so that the carrier controls their costs. The reason is carriers are tightening their budgets because of reduced reimbursement from CMS. So it's important to look beyond that top line number, that maximum out of pocket for the year, and check how your plan's cost structure may change. If formulas remain tight, we might see some upward maximum out-of-pocket adjustments. But for 2026, hey, take the win. Now, if you'd like to see how these 2026 changes affect your plan, please schedule a free consultation. The links are in the description. All right. Question 3. What is up with Part D changes in 2026? Well, we have a few. Some are actually pretty good. The Part D Premium Stabilization Program that began in 2025 is going to continue next year, but with smaller subsidies. The CMS is lowering the average subsidy paid to the insurance company from $15 per month to $10 per month. And it allows plan premiums to increase by as much as $50 year over year instead of the previous $35 limit. Also, the narrow risk corridor adjustments that they used in 2025 are being phased out. Once again, in English, what this means is that plans get less federal cushion if they underprice or overprice the bids for their formularies. So projected changes in 2026. Because these guardrails are looser, some plans, especially enhanced tier drug plans, may increase premiums a little more than we saw in 2025. However, most major carriers have joined the program again in 2026, so wild premium spikes are still unlikely. Overall, expect Part D premiums to stay fairly steady. They're supposed to average around $34.50 per month nationally, but you might see some reshuffling among plans. The stabilization program ends after 2026, so if nothing replaces it, we could see a sharper uptick in 2027 premiums. Of course, you might also see more companies jumping back into the market because a lot of them have pulled out for this year. So for this AEP, as with most AEPs, the main takeaway is simple. Compare your current plan's premium and formulary carefully before you commit to renewing it. You want to make sure your medications are still covered under your plan's tier structure and that the pricing works out for you. Remember, look at your total annual out-of-pocket, not just the premium. So hit like if you're finding this helpful. It helps other people see this video as well, and it helps me continue to make them. Thank you. Okay, question number 4. Do I have to worry about Medicare Advantage plan availability in 2026? Well, there's been a lot of talk about carriers pulling out of the market, and some carriers are pulling out. We're seeing a lot of plans eliminated, especially PPO plans. If you have a PPO plan, you should check with your broker. Make sure it's still going to be on the table for next year. But this is what we know. The CMS expects the total number of Medicare Advantage plans to drop slightly. It's not a catastrophic change. In 2025, we had something like 5,633 plans in total, and in 2026, it's going to drop to 5,600. So that's not a huge reduction. Despite that, access remains very strong. Over 99% of beneficiaries will have at least one Medicare Advantage plan available, and 97% will have 10 or more options. Average Medicare Advantage premiums are projected to decrease to about $14 per month nationwide. However, several major insurers, including United Healthcare, Aetna, and Humana, they're trimming service areas, primarily in rural counties, due to tighter margins and changing CMS reimbursement formulas. Estimated for 2026, Medicare Advantage enrollment is expected to flatten for the first time in a decade. So Medicare Advantage enrollment has just been going up and up and up. But now they're guessing that it's going to go from 34.9 million in 2025 down to 34 million in 2026, which could represent about 48% of the Medicare population. Most of that decline is expected in regions where plans are exiting. Carriers are shifting from PPOs to HMOs to control costs, and we're likely to see more local network-based plans and fewer broad network options. On the bright side, some of the smaller and regional plans are expanding into markets that the large carriers are leaving. So nature abhors a vacuum. They're going to come in and try to fill the gap. Now, if your plan is being discontinued, you will receive a non-renewal notice this fall, and you will have a special enrollment period through February 29th of 2026 to choose a new plan or to return to original Medicare. Now, that doesn't mean you have to wait until that time. You can use the AEP, and I recommend you do so. So, if you return to original Medicare because your plan has exited the market and they're leaving you without an option, you may have a very special one-time guaranteed issued right to buy a Medicare supplement policy with no health questions. So you kind of get a do-over of your initial enrollment period, but only if you apply within 63 days of your Medicare Advantage plan ending. So make sure to talk to your trusted advisor about that. If you don't have one, give me a call. So please make sure to subscribe and turn on notifications. I go live every Wednesday through AEP with updates like this. So Medicare in 2026 brings some new opportunities, a few cost adjustments, and some shifts in how insurers are doing business. But the good news is that beneficiaries still have strong options and more transparency than ever. So visit scottfoxinsurance.com to schedule a free consultation or just give us a call. The contact info is in the description.
Help me out here, Mike.
Thanks a lot for joining me, everybody. And as always,
Can you count it?
stay nerdy, my friends.
Help me out here, Mike. Can you count it?